Welcome, everyone. Thanks for registering for our webinar and attending today. We have a series of two for you on workplace violence. This first session is going to really talk about the precursors to agitation and aggression. And then the second session will provide a little bit more of a role play and actions you can take. So the second session will be on March 27th at the same time. So we do want to try to make this as interactive as possible. So please feel free to use the chat very broadly. We had quite a few more registrants than we initially thought of. So it's going to be a little harder to chat like we had initially planned. So feel free to please use the chat function. One of the things we are pleased about today is that we have a huge variety of attendees across the entire healthcare spectrum. We have people from clinics and hospitals and health departments, and we even have others community-based agencies such as areas on aging, food banks, and other community partners. So we are pleased to welcome everybody. One thing to know today is that if you are a nurse, you may receive continuing education credits for this session and the next session next week. So in order to obtain those credits, first of all, you do need to attend at least 75% of the presentation today. And then you also must complete the evaluation and put your name down, because I don't know who to send the certificate to unless I have that name in the evaluation form. There are no disclosures for any of us to report for this training today. And then I'd like to introduce myself. My name is Amber Rogers, and I'm one of the account managers here at Mountain Pacific. And then my coworker, Julia, I'll let you introduce yourself.
Okay, thanks, Amber. Hi, everyone. We're glad you're joining us today. Amber, I will just comment, it sounded like you were moving a little when you spoke, so I'm not sure, you sort of faded in and out. I'm not sure if that's something you can work on in the meantime. But my name's Julia Drushinsky. I have been a registered nurse for 31 years and have worked in most clinical departments over my career. And my leadership experience has really centered around quality, safety, and risk management in healthcare, including security and instructing teams on managing aggressive behavior through several different platforms. Okay, so as Amber mentioned, this is actually session 1 of 2. And today's session, we will be covering these top 2 objectives. Describe common trigger events for patients and visitors who display escalating behaviors, and identify signs and symptoms of increasing agitation and movement towards possible aggression. In session 2, as she mentioned, we'll kind of get a little bit more into the nitty-gritty about, we'll do a few role plays for you. We'll talk about some policies and do some post-incident debriefing steps and reporting. So more to come on that. So hopefully you can join us again on the 27th. So in the meantime, we'll go ahead and move along next. So workplace violence is a threat, an act of violence ranging from verbal abuse to physical assaults directed toward persons at work or on duty. The impact of workplace violence can range from psychological issues to physical injury or even death. And so we just have a couple little chat questions. We decided not to pull this, but again, please make this interactive and find your chat button or even come off mute if you like. The first question is, the most common type of workplace violence in the healthcare setting is A, worker on worker, B, patient, visitor, staff, C, criminal intent, which is robbery, vandalization of property. And I did see actually a poll pop up there, so give it a moment here. Are we seeing some results on that yet?
Yes, we are seeing people answer the poll.
Okay. And what are they choosing B, because B is the answer, patient visitor on staff. And I think that most of us probably could have guessed that. A common type of workplace violence on the poll here is also criminal intent and worker on worker. And that poll showed that probably about a third of you chose worker on worker. And we do see that. In fact, hopefully in the near future, we'll actually have a presentation specifically focused on peer-to-peer. So our next question is true or false? Healthcare and social service industries experience the highest rate of injuries caused by workplace violence. True or false? Go ahead and click your poll there and we'll see what you say. I'd also like to remind everyone that I will be speaking specifically a lot about healthcare today, but really this is all applicable to all types of service injury or injury service types of work. And so do keep that in mind. I might be using that term healthcare, but it does apply across all those service types. All right, slide 7, 88% of you said true and 13% said false. And so it is true, healthcare and social service injuries experience the highest rate of injuries caused by workplace violence. In fact, up to 13,000 have been reported related to workplace violence injuries in healthcare. So it seems natural and very easy for us to begin this topic talking about patients or the public. But we will actually start by having a conversation about ourselves as individuals and our organizations, which seems a little contrary, but bear with me. We understand that there is a level of risk for individuals working in the healthcare setting or other public service entities. And it's important to understand the role we play as individuals in preventing or escalating possible dangerous situations. And part of this involves learning to work with a non-judgmental mindset. So judgment manifests itself in verbal and nonverbal manners in ways that oftentimes we don't even recognize. And we'll talk more about this later in something called paraverbal communication in future slides. And it's difficult to understand that people are not their behaviors. It does not mean that we view the other's aggressive behavior as any way okay or permissible, and we probably find it quite disrespectful. However, if we can look beyond their behavior and assess for the unmet need, when people are stressed, they're not very good at communicating their needs. So if we can look beyond that behavior, manage it the best we can, and look for that unmet need and be curious, it will help us understand the trigger for their behavior. So when you can separate out that behavior from the person, you're also able to kind of gain some compassion and insight for who they are just within the situation that they're in, which is at that time with us in our service. So one example I would like to share, it's personal, and it's about a dear friend of mine who lost her young daughter to cancer a couple years ago. And it was a pretty gruesome, long, hard-fought battle. A couple years after her daughter's death, my friend, whom we'll just call Deb, needed some radiology exams. She had put her own health by the wayside during her daughter's 5-year battle. On her first visit, the MRI department, the radiology department, was quite behind in their schedule when she arrived, and she was having a very long wait time. And being in that MRI department made her extremely anxious, as she spent many heartbreaking hours in that department, and it always ended up in very sad and tragic news. So she was reliving many of the horrible memories that she had experienced. And she had actually already canceled one appointment prior to that, just to the thought and the anxiety around the situation and having to go there. And so she was trying to be brave that day. And she tried to generally explain to the staff that she was really struggling with the wait time due to a personal situation. And could they please just tell her how much longer? Any way they could work her in sooner, reschedule. And or at least take her to a different room. And she essentially begged them and ended up raising her voice a couple times because she had gone up to the desk twice. So during that time, she was not asked how they might be able to make things easier for her related to this situation that she had commented on. In fact, the staff were very impatient with her and with what she considered rude. And she ended up leaving that day without her exam, which was not a good thing for her health choices. So I'd just like to open it up. You can come off mute or you can put into chat. If that happened at your facility, or perhaps you were the person at registration that day, what do you think you might have been able to do a little differently? And please do join. It makes our time together go a lot faster and we can actually learn quite a bit from one another. Do you guys have any suggestions how that could have been handled a little better?
And we can also take anybody off mute if they would like to kind of relay another alternative to that. Some of Julia's suggestions. Deb Hockett says accommodate her need from the registration or clerk person.
Very good. Accommodate. Anything else?
Also be empathetic based on the amount of amount of information that the patient shares. And then another person suggested allowing her to wait in a separate area that's not with so many other patients.
Yes.
Yep.
So good. I'm seeing other chats up there. I don't get to see them all, but I see them popping up. All just really fabulous ideas. Thanks, you guys. It's, just saying yes, finding a way to accommodate her. And ultimately, she did reschedule, and thankfully she was able to connect with someone who used just that. Someone also popped in, used the LEAD acronym. Yes, listen. Very good. So she recognized that she had a unique situation and then happened to then remember, oh, I remember seeing this gal and her daughter. And so she got curious and she asked questions. She did just that. She recognized that the behaviors of my friend were part of her past and actually her current situation with some trauma. And so she made a point to go get her immediately upon arrival. She actually put her in a room, just like someone suggested, that wasn't quite so triggering. And then she took the time to gently walk her through every step of the exam. She ensured there were no delays. When they rescheduled, she found a spot where it was most likely that they wouldn't be behind during their workday, and really just took care of her and helped her manage her anxiety. So I was so thankful to hear that this gal was curious and took the additional time to do just as a lot of your suggestions to accommodate her and make sure she could get her exam, which thankfully she was able to get it that day because there were some issues that were discovered.
So Julia, just for some of our audience that may not be as familiar with the acronym LEAD, can you explain what those initials mean?
Yeah, and I might not remember off the top of my head. Does the person that chimed in want to come off mute and tell us? Listen, I've seen it in different ways. Listen, empathize, accommodate.
So are you asking about LEAD?
Yes.
Okay, so this is Carrie Cross. I work at Billings Clinic in Billings, Montana. I see a lot of our regional partners are on today, which I'm very thankful for. So hopefully they also know what LEAD is, but it's listen, be empathetic, an accountable action, be accountable, and do something. So by being empathetic and accountable doesn't necessarily mean that you're saying, yes, it's all our fault. Listening, I think we all quite understand that, being empathetic, but the being accountable is, how do you take responsibility without putting blame on yourself while also validating somebody? That's the key. So sometimes it's combining the E and A together by saying, either I am so very sorry this happened to you, this should not be your experience. It could be, it looks like you are having an incredibly devastating day. And then you have to follow up with the do something, right? Like, here's what I can do right now. Why don't you have a seat over here? Let me go and get this done for you. Let me get some information. Let me do the follow up for you to kind of get you from point A to point C. Let me kick this up to my supervisor. You know, like, there's different things that we can all do to help support what, you know, somebody that seems to be in some sort of crisis. So really that's what it's about, is making sure that we're listening, we're being empathetic, and just supporting them. I mean, if it's a parent and they're having a frustrating day, I'm a parent. I put myself in their shoes and I'm like, yeah, I would be so frustrated right now. I mean, there's just, yeah, you just have to do that. And but yeah, that's how we use LEAD. We actually are extending LEAD, and we're adding an ERR to make it leader for our organization. But LEAD is the evidence-based approach that we stemmed from. So
Very
thanks.
good. Thank you so much for sharing. And we do in our session 2 talk about those types of policies and acronyms. So I really appreciate you sharing that. There are quite a few programs out there. They're all a little different, but they all have those key components, and it's listening and action, acknowledging in some sort of action, which, and we'll thank you. It was a fabulous lead in actually to some of the other slides we have today about validating people. And it doesn't necessarily mean you're acknowledging guilt about anything. So thanks for that. That's great. And so keep that in your back pocket. And if anyone else has other acronyms that they use, we'd love to hear you guys share those, especially on our second session when we talk about some policies and things. So moving on, just be curious about unmet needs and expectations to better understand and serve the people that you're working with. And I get it. It can be really difficult to take time during crazy, hectic, busy work weeks, but truly it's worth it in the end, and the results are worth it. So I want to talk a little bit about personal bias. Recognizing bias we carry kind of takes us one step closer to both helping ourselves in our workday and our patients navigate the healthcare system. So Webster's says that bias is a kind of a leaning of the mind, a propensity or prepossession towards, you know, one object or one view, and not leaving the mind indifferent. And so then Wikipedia defines it a little bit more, where they say, call it out as really a disproportionate weight in favor or against an idea or a thing. And it's usually in a way that's closed-minded, prejudiced, or perhaps unfair. So biases really can be innate or learned. Of course, we are so influenced by our environment sometimes, and people may develop biases for or against an individual, a group, or a belief. And there's many different types of bias, but I am not going to go into those today, but just do want to say, you know, to have a personal bias is really just to be human, right? We're all human. We all hold our own views and beliefs, and are influenced by so many different things. That can be our upbringing. It could be our education. We are shaped by our friends, families, and coworkers. And we're also shaped somewhat by our own work culture. And so those are things that we need to think about. But taking the time to become aware of your own biases is important to both personal well-being and work success. For instance, I might have a real positive bias towards someone that is of my own faith, if I'm religious, or even just went to the same college, right? I could be chanting "Go Bobcats" right now, versus a negative bias towards someone who asks for a religious accommodation, perhaps, of a certain faith that I know little about. Or maybe I have a negative bias towards anyone that expresses something religious, or even just that went to a different college. I see someone saying, "Go Cats," yes. So of course I'm talking about bias between Grizzlies and Bobcats here, just to show you that really a bias can be anywhere, and we need to acknowledge those to improve ourselves in the work that we do. So people with a higher degree of self-awareness are likely to be more successful in managing challenging situations at work. So when you realize that, you know, that what your personal triggers are and how those influence or create your personal bias, you can actively manage it or even perhaps avoid them. But developing that self-awareness helps you navigate obstacles, helps you better serve your clients, and makes your work time definitely more enjoyable. So we're going to discuss more on triggers here shortly. But in the meantime, I challenge you to think about some of your own personal biases related to work. And if you're comfortable with that, you can certainly put that in chat, or you can even put it in anonymously or to the whole group. But I'll be a little vulnerable here and tell you that one of my own personal biases that I had to overcome was related to the many years that I worked in the emergency room department. I had a bias against those with substance use disorder and the challenges that sometimes their situations brought into my work environment. And I am sure that I sometimes used stigmatizing language, both verbal and perhaps even body language. But I did work finally to really better understand the more I got into quality and risk management and just an understanding of work personalities and relationships with our patients. I really worked to better understand where that came from and to be curious and include empathy in that curiosity. And now I actually find that I prefer work in that substance abuse realm. So Amber, is there something that you might want to contribute or chime in regarding bias?
Only that implicit bias is within everybody. And so it's not something necessarily that you're always reflective of or aware of, but you can, like Julia said, combat that and, you know, uncover when you were feeling uncomfortable and kind of work through those emotions so that you really get to the root of that. And you may never conquer implicit bias completely, but you certainly can learn techniques and humanizing behaviors that will help you in all kinds of circumstances throughout your life, whether that be at work or else.
Great, thank you. Is there anyone that put anything in chat, Amber?
No, not quite yet, but we'd be happy to hear other potential groups that you have some implicit bias maybe against. I know that some people have some negative emotions around homelessness, substance use disorder, as Julia mentioned, you know, are common ones. Mental illness, stigma against people experiencing mental illness is also high. So we do have to remember and deal with those emotions within ourselves.
Yeah, thanks, Amber. Thanks for that. So I just want to touch a little bit about cultural influence, and they definitely can affect how we approach or react in particular situations. So being aware of cultural differences and even our own bias in how we judge something in terms of our own culture and beliefs, or, you know, that lens that we view others through is really impactful. And also, you know, how do we view members of a different cultural community and how does that influence our work? So again, just encouragement to take some reflection and think about your own personal beliefs and some biases that you may carry with you. You know, even little things like the tone of voice, eye contact, and those types of things can be really influential. And of course, you know, that work culture, we all work in a type of work culture that affects what we do as well. So emotional intelligence is the ability to perceive, evaluate, express, and control emotions. So knowing and understanding yourself with regards to how you handle your own emotions can be a little humbling sometimes. For instance, do you tend to over or under react in stressful situations? Ask yourself, how do I normally cope when confronted by someone who's angry or upset at me when I'm outside of the work environment? And is it effective? And how does that actually translate to what I do in my work environment? And sometimes how we handle things in our personal lives and how we handle things at work are not congruent, and it takes some adjusting and taking a look at how we can improve things, maybe one way or the other. And then how do you normally manage your personal and work stressors? You know, are your methods effective? You know, do you use things like the employee assistance program? If you're stressed at work, do you mitigate your stress in other ways by making sure you take a lunch break? You know, do you have practices that you utilize? And if not, take a look at making sure you're implementing some of those. It's also very helpful to understand the effects of that rational brain or the thinking brain versus the emotional brain. And I'm sure all of you have heard, you know, some of the conversations or education around the prefrontal cortex and the amygdala is the emotional part of our brain. And we won't go into depth there, but just remember that acting with the emotional part of our brain generally results in ineffective reaction. And so if that's something personally you need to work on, it's completely doable, because we know that neuroplasticity allows us to learn to manage our behavior responses to stress. And therefore we can really influence those people that we work with by managing our own emotional intelligence. So it's important to learn those techniques to build rapport, and then how to use those to de-escalate during stressful situations. I'm going to be asking for a little bit more here. So to better understand both ourselves and others, we do want to talk about triggers. The term is used a lot more casually these days, but definitely want to clarify there is a difference between being just a little mildly uncomfortable and offended versus maybe how the term trigger is being used in the behavioral health environment. A trigger refers to something that affects your emotional state by causing overwhelm or distress. And there are a lot of ways that our patients and clients get triggered in our work environments. And there may be many ways that you as a healthcare worker get triggered in your work environment. A trigger affects your ability to remain present in the moment, and it can be very distracting, right? It may bring up specific thought patterns or influence your behavior, your client's behavior. This influence applies to both you and your patients. So a trigger could be, you know, something as simple as the scent of a cologne that brings up good or bad memories or an event. Some people can be triggered by the perception that perhaps they're being judged. We just talked about some of that stigma or bias, or when they're not validated in their feelings. It could be as simple as a tone of voice or the way you carry yourself with your nonverbal body language. So there are a lot of common trigger areas in healthcare, like I mentioned, but a few of them are here on the slide. You know, conflicting expectations. Definitely we see patients upset because their expectation of how their visit or their time in our services may be very different than what the reality is. Wait times, another big one. We talked about, you know, my friend and how that was a trigger for her. COVID-19 visitation policies. We all probably could raise our hand to that, and some sorts of triggers that, you know, some of those COVID things are still occurring within our organizations. Perhaps the type of language you use. Perhaps it's communication barriers, lack of follow through. How many of us personally have waited for a follow through from a provider or a lab result or something like that, which can be very frustrating. Body language, sorrow, fear, many more. So let's kind of learn from each other again. I'm very curious about what you all feel or see are very common trigger scenarios for aggressive or agitation within your organizations, especially because we have quite a variety group of people here today. It's not just solely strictly in the hospital environment. So please do feel free to unmute your line to speak, or go ahead and chat in. We'll just take a few moments here. What are some of the common triggers that you encounter or scenarios that you see happen in your organization that sort of foster that agitation and aggression? The first step to working on these is to acknowledge what they are, right? Mask mandates, yes. Visiting hours, absolutely. The last organization I worked didn't have visiting hours, and it was such a great thing. Intoxicated or drug use, meth, uncontrollable patients. They don't even listen, do they, right? Because they can't if they're in that state. What else do you see?
I think one of the big things too is when, especially when you're waiting in a waiting room, perhaps in the emergency department, that those people might be experiencing quite a bit of pain, which brought them to the facility to begin with. And then they sit there and they wait, and then they just fixate even more on the amount of pain, and that they came here to get pain relief,
Yeah,
and
exactly.
they're
Right.
waiting and getting quite frustrated. I see a lot of other kinds of comments again about intoxication, controlled substances, loud noises. Honestly, that is a trigger of mine. I get like so anxious when things are super loud in a chaotic environment. So yeah.
Yeah. Oh, I'm seeing a lot of really, I hope you all are looking in the chat and seeing what people are putting in, even in food banking, perception that other people are getting better food. You know, that happens in healthcare when someone has been sitting in the waiting room and they see someone who came in after them go in ahead of them. Very similar interdepartment communication. I saw some of that for sure. Communication, expectations, and that darn old drug use, really creates a havoc.
Can I
So,
comment on that? Because we were just talking about substance use stigma. So
sure.
when we're talking about substance use, what are we saying the trigger is?
So the trigger could be from many areas. First of all, it could be a trigger for us, like it used to be for me. And substance use, a trigger could be that they're having to wait. And that is, in my experience, has been a trigger for people that perhaps they feel they've been stigmatized and they're having to wait unfairly to be seen. Or perhaps they've been asked to stop some behaviors. Anyone else chime in that put in substance use? What do you think specifics on those triggers are that you're experiencing?
I think the feeling of being rejected causes a lot of the trigger when patients that have substance use disorder kind of fly off the handle, that they've already felt rejected, so they're going to reject you before you reject them.
Okay.
Well, and I just, sorry, my name is Mary. I'm sharing a screen with Jessica right now. But I guess I want to point out that we're talking about the substance use being the trigger, but I mean, I want to reinforce that a lot of it is the stigma within healthcare. And it's not just the person's feeling or perception, though that might be part of it. It's also a real thing they're experiencing. So I just want to put that out there.
Yeah, definitely. And that was one of the things, thank you for that I actually had to learn when I was carrying some bias, because there might have been some disruptive behavior or something, but actually looking at the stigma and all of it that comes in a package that isn't directly related specifically to the substance use. Well, thanks everyone. I hope you're all looking in chat. I can't see them all. I can briefly see them as they pop up. So I appreciate you participating, and thanks for coming off mute too. All right, we're going to go ahead. Next slide, Amber. And we're going to talk a little bit about reactions and responses. In fact, the way you respond to triggers or events or behaviors is crucial in the mitigation sometimes of these behaviors. So interestingly, a great predictor to workplace violence is staff reaction versus response, meaning reactions invoke, according to research, more violence potential and conflict than a practiced response. Yeah, so stigma is real. I got distracted myself by some of the chat pop-ups there. So reactions are done on impulse without necessarily putting a lot of thought into it or considering what the end result may be. They often lack cognition. They're a lot easier to perform, essentially, for a better word, and they're usually subconscious based. I think we have all overreacted at times or been reactive in a situation that we later regretted. And some reactive responses, sometimes are meant to keep us safe. I think about physically when, as a mom, and you're slamming on the brakes and your arm goes out to hold in your already buckled child, or perhaps they're headed to the street and you just reactively scream at them to try to get them to stop. But a different example may be perhaps when a family member is very rude and pushes a button and calls you a rude name or something along that line, and you just react and shout back at them. And that is a type of reaction that sometimes is very impulsive and not the best, but it happens because we're human and we do those things. But a response, on the other hand, uses more reasonable critical thinking with intention. A response is more thoughtful and done with more reasoning. It's more safety oriented and more empathic. And this, again, a lot of what we talk about needs to be practiced. It's hard to implement these types of things when someone's coming at us, perhaps in a very agitated state. So again, learning to respond versus react, taking a good look at yourself, am I a reactive person? And practicing responses and what we can do as an organization to help people practice responses is very important. So it really does take that intentional effort. But the good news is, again, that they can be practiced and our brain can be trained. So some places do practice scripts or specific language, just language helpers with little cards for staff to practice and train. I encourage everyone to take some of your real life scenarios you've experienced and role play those. Set aside the funny feelings about role play and work through those with some practice scripts and learn from each other. Staff meetings, group trainings, or even just if you are a leader in your organization, taking the time to walk to your departments, learn what's been going on, and talk through ways to manage those types of situations. Yes, deep breaths before reacting to a patient can help, for sure. And we're going to talk about some of those things towards the end of our next session. We have kind of a little acronym actually for staff to take a moment. And we'll talk about it throughout our training about kind of getting yourself in the right frame of mind to possibly respond better than react. So thanks for that. So we're going to get into, this might be a little tedious for you guys, but I do want to talk about recognizing when people are experiencing anxiety and then kind of escalating those behaviors, because the sooner we can get ourselves in a mindset when people are kind of on that lower spectrum of anxiety and help find their unmet need and help them and keep our own selves calm in a stressful situation, the better. And that first starts with recognizing some of these things. So let's talk about, we'll talk about anxiety or agitation. Then we'll talk about how people kind of move into more of an emotional confrontation. And then we'll talk about some physical aggression types of things. So it's important to remember again that we want to intervene early, and our goal is to try to identify that unmet need and de-escalate the situation. So this is an ideal time to identify their belief or what issue they're having and how we might be able to address that. And notice I did not say resolve, because I think someone mentioned before, we might not be able to resolve what their issue is, but we certainly can address what's going on. Observational assessments, also known as observational acuity, can really be practiced, and usually early intervention then does help keep that escalation at bay. So just as with other safety topics, awareness is key. Be aware of what's going on in your waiting rooms or wherever it is that you're working. So whether you're in a dark parking lot after work and walking to your car, we would want you to be aware of what's going on. Or in a busy public place, we want you to learn to practice that in your work environment too. Whether that's in your own little area, maybe a department that you work, but also as you walk into work in other areas of the building, because we're all in this together. So most of us recognize or even perform, those typical anxiety gestures. And that might be including, keeping your head down and you're pacing around. You may see someone with kind of an eyebrow twitch or even a lip twitch. Maybe they're doing some shallow breathing. They might be sweating some, or perhaps their face is starting to get a little red. They may have some expression in their eyes, such as this gentleman. You can see he's got kind of a pacifying gesture of kind of rubbing his head, a little grimace on his face. His eyebrows here are raised, but he's also, he's got a hand cocked on his hip there. So think about what type of gestures you perform when you're stressed and what those may look like. And then also think about micro gestures or expressions. They're also often those real discrete things that people often don't even realize they do, and they can occur in just a fraction of a second. It could be just a slight change in their tone of their voice for a few moments. It could be their eyebrow that raises or arches, or their eyes widen. And I've actually started to practice this, and it's amazing now what I have started to recognize both in myself, but in just people around me. I become a good people watcher, not only, just out in public, but perhaps even when I'm in an event where I have other coworkers around me. So I do challenge you and your staff to start having that observational acuity and start, lifting your head up and really taking a gander about what's happening around you. Start recognizing some of your own nonverbal cues, because it'll help you recognize them in other people too. So like I said, I recognize that when I'm stressed, I get an eye twitch. And I also have started to notice I have a lip rubbing. It's a pacifying gesture like this. And kind of gross, being that I am also an infection preventionist. And so now I want to use hand gel on my hands that I did that. But pacifier behaviors really can just indicate an emotional shift. They're also known as soothing behaviors. You probably do some yourself. You probably have noticed, if you have children, them doing that, or grandkids. And so you can see that on this gentleman in the picture. You might also notice, some collar pulling, maybe this rubbing the neck. Some people get oral fixations where they're chewing on a pen or start to chew on their nails. Fidgeting. Oftentimes I see this cupping of elbows. I'll stand up just briefly here like this, or rubbing arms. How oftentimes have we seen people, when they're sort of pleading their case, they have their hand on their sternum or hand to their chest, right? They might start practicing that deep breathing that we do want people to practice. And so just take a look around and start to learn to recognize those. And the eye contact rule can be taken a little bit with a grain of salt, but overall, research will tell us that staff should maintain eye contact about 60 to 70% of the time when you're speaking to someone. You don't want to stare them down like this, and about 90% eye contact when they're speaking to you at the same time. But do read this in context to the person you're with, the context to the situation, perhaps cultural situations, and adjust your eye contact really based on that. So just moving on, I did want to touch on a little bit about intuition. Sometimes we get these questions a lot. So intuition actually can be valuable and can enhance your observational skills. When we're talking about observation, it can be considered like a balanced sense of fear, and can provide some early recognition that something in the environment just isn't right. It's often a nonverbal cue. So it's kind of that nagging feeling, and it's your emotional brain and your thinking brain. Spidey senses all the way, right? Stacey says we talk about that, especially as healthcare providers. It's that bridge between your thinking brain and your emotional brain having some sort of tug of war conversation that something's just not right. You feel that nagging in your gut, and perhaps if you turn on your thinking brain and look around, now that you know your observational skills are there, you might notice something that is just a nonverbal cue that's out of place. But I want to caution you here. Our intuition really comes, our gut feelings, our spidey senses, whatever you want to call them, they're not really concerned with accuracy at the moment. They come from our primitive brain that's protecting you. So basically, what you feel might not necessarily be accurate, but it's talking to you about safety. So then you can then say, hey, I have a gut feeling, I'm going to pay attention here and see what I might be able to pick up. So I challenge you all to practice your observational insight and start recognizing those anxiety cues and talk about, what can I do in this moment? So if you see this gentleman, obviously something is amiss. Tell me, what could you do at this point? If you're in that work environment, what might you do to address it at this time? Smile and wave, acknowledge them, okay? Smile is always a good idea, right? Make some eye contact. How about the good old customer service, things that you have learned? Yeah, ask if there's anything I can do to help them. Open body communication, we're going to talk a lot about that, being approachable. So yeah, why not ask at this time, right? It could really save you a lot of heartache in the future if this gentleman is the type to kind of escalate. So let's talk about escalating. Yeah, ask. It makes common sense, but you'd be very surprised how often we do this and put our heads down and continue to work because we're in this crazy work environment, right? Okay, so if anxiety or agitation is left to escalate, people can move then into more of an emotional confrontation. And like anxiety, potential confrontation has more obvious hints as well. And that seems like common sense, right? Like we should just be able to hone in on these people that are escalating and continue to read chat because I'm seeing some good stuff in there. So, but sometimes people can quickly move, depending on their mindset and their situation, into confrontation. So here, obviously, that smile that we've been talking about is gone. You might see a frown. Instead of sort of this thing and maybe their head down and they're just sort of quietly moving around or doing those pacifying types of behaviors, they may now come towards you more standing tall with their shoulders square. And they're more direct, right? Their direct eye contact may actually be a little penetrating towards you versus them looking down. They may be finger pointing. They may be breathing that quicker, deeper breathing. And they may even be raising their voice, yelling, swearing, all of that jazz. It can really come in a lot of different formats and can start subtle and certainly escalate. Okay, they may not move as much and they're definitely going to be a little more direct with you and in your face. You might also see some disdain or contempt towards you. Sometimes people can come at you and make things feel really personal. You really suck at your job. Why have I been waiting so long? And this is that time when we talked about as for ourselves, it can be really scary and upsetting. Taking those deep breaths, and we'll talk about other techniques to help you here too, but they might come at you with that contempt. You might just see a crook or maybe a curl or pursed lips as they glare at you, and you will probably see a change in their tone of voice here. So again, that this can quickly move or escalate. And so again, what would we do here? If someone came at us this way, I'm really curious, what would you do? Do you have policies in place here or processes that you would be, maybe if someone was yelling at you here, calling someone else to come be with you to help you manage this? Or is this something that you would start de-escalating yourself, trying to find that unmet need and help them? I'm very curious because everybody has different processes here. Okay, overhead page, someone put in their code gray, code silver, Dr. Strong, whatever yours may be. Okay, someone else said they would just de-escalate at this point. They wouldn't need any other help at this point. They really try to calm them down a bit, which we could definitely work here. Yep. Everybody has different processes. And so the key here really is to take a look at your common scenarios, right? What you have typically experience, what are the triggers for people, and start looking at them one by one and looking at what you do during those. What works, what doesn't, and what doesn't, it's like a gap analysis and quality. You're going to take a look at changing something, maybe some more education or a process change. Someone said they try to de-escalate and the other said she doesn't look like she wants her problem solved. And sometimes does it not feel that way, that no matter what we do, there's no going down, right? So we're gonna be talking more about processes in our second session. So again, really taking a look, what do we do? Perhaps you don't know because there isn't a process and everybody handles things different. But if you're a leader in your organization, please do give permission and training for your staff to help someone meet their unmet need at the time they're with them, okay? And so we're gonna talk about more about that later. And, you know, sometimes all it takes is, gosh, it makes sense that you're so frustrated right now. Let's talk about what we can do to help you, okay? Depending on the situation. Speaking of people who don't want to maybe listen to us at this point, movement to physical aggression can really happen quickly, particularly if cues were not intervened on during the anxiety and the emotional confrontation stages. I kind of liken this to a bear. You know how bears will stand up and kind of assess situations, sniff out things, make their presence known. You know, I liken those first two categories, especially the confrontation one, to the bear that's doing that. And then the physical aggression, moving to physical aggression, I kind of always have had this picture in my mind where they hop down to all fours and lower that center of gravity and start making some noise. They start growling. So here you may see, you know, early on we talked about eyebrows being raised, like really, what is going on here? Maybe the eyes widen. Here you're definitely probably going to see those eyebrows drop. Usually their head is starting to come down now. There, you'll see a change of stance. You know, if they're coming towards you, those shoulders may be rolled forward more. They may be sort of bobbing and rocking. We've all seen that. Yes, we're going to talk about listening for sure. And their verbalization may change, right? They may go from this yelling, screaming to becoming very quiet. You may hear them softly muttering things or something along that line, or they might just be quiet. Their breathing may change at this point. When we get to release some adrenaline or do something physical, don't we start taking deeper breaths? We start oxygenating those cells, right? Sometimes then their movement will stop. They'll sort of drop that center of gravity and they'll do something called a target look, which is they'll break that eye contact with you. You know, they might have been staring you down and they'll actually look at a body part or a thing or something, and that can indicate what they're going to physically attack or be aggressive towards. So here, we don't go into detail on drills and things in these two sessions, but this is important that you have your workplace violence policies in place to what you drill for instances when people do get aggressive here. So the run, hide, fight are essential to drill within your workplace safety. It's essential to look at your work environment. Do you have escape routes? And if you don't, what is your process to take this person who is across from you to move yourself to an area where you can escape if necessary? And we're going to be talking more about that. But just keeping in mind that if you're the person that is like, oh, another drill, I don't want to participate, they're really there for a reason. And if you're a leader, making sure those drills happen is really important as well. So I really would like to know at this point, what are people drilling? Do you have platforms that you use for aggressive training? Do you use something like run, hide, fight? Do you use something run, hide, escape? CPI, Yvonne says they're using crisis prevention in their organization. Good. What else are people using? You can come off mute too, or throw it in chat. Or perhaps you're not using anything. Maybe every department's doing their own thing. Is anybody using something called Aegis? Run, hide, fight, CIT training, and when we can send the staff, health stream training, part of orientation, great. Always at the very minimum, health stream training or orientation training. Somebody did say they use Aegis. Someone else said, yep, they're using codes and drill those. Moab, yep, very familiar with Moab. I used to be a Moab trainer. Teams. Okay, silver active shooter tabletop EMS exercise. Somebody's very much into their disaster preparedness or workplace violence preparedness, which is great to hear. So what you want to know next is, what do your staff know that you're using? All right. So walk through your departments. Bring this up in your staff meetings. If you're a leader, I encourage you, or even just a staff member within a department, I used to walk through and say, hey, we're going to do a quick scenario here. A gentleman's walking through that door right now, and he is mad, and he just picked up that IV pole and he's coming at you. Okay, what are you going to do? Let's talk about this. Throw candy. Okay. Moab, good. Be reading in chat, you guys. There's a lot of good stuff in there. But you may know what you're using, but how much do the other staff know what you're using? And have they actually been able to practice? So I encourage you, when we're talking role play, practice. Be a leader in practicing. Look up run, hide, fight. Make sure you're doing drills routinely. Make sure you're training it in orientation. And mostly talk with individuals in each department, because they will know what works for them in their own department and what doesn't. Because we can plan all we want on a tabletop, but until you go to that department and see what you wrote up, if it actually works, you may be surprised what doesn't work. So teaching people, oh my gosh, so you don't have an escape route behind your desk. So what are you going to do? Are you going to stand up? Are you going to ask them to walk with you? Are you going to call for help to get them to a different area? All those types of things. And we'll talk more about these in our next session. Yes, file incident reports. Learn from your experiences. Near misses need to go into the incident report scenario. And so that management can support you and follow up on those, your risk manager. So I think, Amber, how do you feel about moving ahead? We'll cover back to basics of de-escalation in our next session, and personal space, hand gestures, and all of that in our next session. And how do you feel about moving ahead to our little scenario?
Sure.
Okay, so we'll go back to that basics of early de-escalation, talking about our hand gestures and our body language and things like that at our next session. Amber and I, Amber can win a Grammy here, but we are actually creating some enduring content with some of this work, and we were videotaped in some of our scenarios. And I'm going to confess here, when she came at me as an angry patient, I sort of like lost my mind a little bit. I used to think I was very practiced at de-escalation, but yes, it has to be practiced routinely. So do that with your people. So I'm just going to set the stage here. We don't have this recorded. It's kind of, difficult in the virtual environment. But Amber is a patient, and she's been waiting in an outpatient setting. She is in a room, and you can watch her. She's getting agitated there. And I am a nurse, and I hear some yelling, and I'm going to walk in and address what she's doing.
I am so sick of this place. I mean, seriously, this is the worst place I've ever been. I cannot believe this. Is there anybody out there?
Hey, Amber,
What?
you need to stop yelling. Like, lower your
You
voice.
can't tell me what to do.
You're in a
I have
health
been sitting
facility.
here for an eon, and I don't know what is wrong with you people. I mean, I have been here for 2 hours minimum.
Listen.
Don't you yell at me.
There's
This
a lot of
is
sick people here. The doctor's in
your
an
fault.
emergency. So you just need to take,
The emergency.
I'm going to call security.
Fine. I don't care if you call security, because I'm going to leave, because you suck.
You know what?
And I'm just going to leave.
You're going to do what
You know
you
what?
need to do, but you should just take it.
I am going to do what I need to do. You can just go away right now. I'm getting my coat and I'm leaving.
Fine, do it.
Good.
Okay. All right, guys. Wow, did you think that was impressive or not impressive? The best actress award goes to Amber Rogers. Definitely, right? So
Maybe
our
I missed my calling.
were you in my ER last week? I love it. So really our intent here was to have gone through some of those de-escalation techniques. So what you should and shouldn't do, and then initially show you this one. So obviously, what did I do that was not good, you guys? You can unmute too if you want, or just throw it into chat. What did you recognize that was bad? I told her to just calm down, right? Does that ever work? No woman wants to hear that, right? Yes, that was the first no-no, right? What about my hand gestures? What did you notice there? Never works to tell someone to calm down. Not nice to point. Yep, I kind of was in her face. You'll see that in the video. Pointing. Yeah, I did this, like whatever, right? That's called hand evasion. We'll talk about that next week. Doesn't give her a lot of confidence, does it? I was argumentative with her. What else? Anything good? I don't think there was one thing good about that scenario. Raised voice, right? I said, fine, leave. My tone and volume for sure, definitely. Bye. Okay, well, thanks for humoring us, you guys. We ran a little short on our planned time, but we're going to end it with that scenario and let you know that we're going to show you a better scenario next time. And even when we videotape this, it wasn't ideal circumstances. It's really fun to go look at, ooh, I wouldn't have gotten that close to her, or ooh, I would have done this. And we can all kind of learn from each other with that as well. So more to come on the 27th. We appreciate you joining us, and I really appreciate all the interaction, and we'll go ahead and let you go. Amber, tell them what they need to do in the way of evaluation and things. We want to make sure you guys get your CEUs for this.
Again, just fill out the evaluation and put your name at the very bottom, and we will send out those continuing education credits at the end of the second session.
All right. Thank you, everyone, and hopefully we'll see you next time.